Moving on to Chapter 2, Actions to Take Before Helping. So you want to perform a scene size up every time you respond to an emergency. So according to the American College of Emergency Physicians, you should call 911 to help if you answer yes to any of the following questions. Is the condition life-threatening? Could the condition get worse on the way to the hospital? If you move the person, will it cause further injury? Does the person need the skills or equipment of EMS? Would distance or traffic cause a delay in getting the person to the hospital? The ACEP also recommends that 911 should be called immediately for people with the following conditions so that they can be brought to the hospital by ambulance to get professional medical care. Difficulty breathing or shortness of breath, chest or upper abdominal pain or pressure lasting 2 minutes or more, a fast heartbeat at rest, fainting or passing out or unresponsiveness, difficulty speaking or numbness or weakness in any part of the body, sudden dizziness, confusion or changes in mental status, unusual behaviors or difficulty walking, sudden blindness and vision changes, bleeding from any wound that will not stop with direct pressure, broken bones visible through an open wound or a broken leg, drowning, severe burn, extremely high or low body temperatures, allergic reaction, especially if there is difficulty breathing, unusual belly pain, poisoning or drug overdose, loss of responsiveness, spinal cord, head or brain injury, severe headache, any sudden or severe pain, severe or persistent vomiting or diarrhea, coughing or vomiting of blood, choking, psychological, emotional, or behavioral emergencies such as threatening to hurt or kill themselves or someone else. When calling 911, you want to make sure to speak slowly and clearly, almost the same way that you are speaking to your victim. You want to be ready to give the dispatcher your location, the phone number that you're calling from, and your name, a brief account of what has happened, the number of people needing help and any special conditions at the scene, and a description of the person's condition and what is being done to help them. You're going to want to listen to what the dispatcher tells you to do, and if necessary, you can write those instructions down. Don't hang up until the dispatcher tells you to, and you're going to want to stay with that person until EMS arrives. While you may not be legally required to help another person, most people do believe that helping others is the right thing to do. However, you must help when you have a legal duty to act. So that could be your employment describes it, such as, it's in your job description. Or if there's a pre-existing relationship, such as parent-child, teacher-student, driver-passenger. This does include foster parent, foster child. So you do have a legal duty to act and save your foster child. Lay responders must be cautious about revealing information that was learned while caring for someone. The law recognizes that people have the right to privacy. Do not discuss what you know with anyone other than those who have a medical need to know, such as EMS or a professional medical physician. The exception to this rule is when the state law requires the reporting of certain incidences such as rape, abuse, and gunshot wounds. Good Samaritan laws provide reasonable protection during lawsuits and encourage people to help others during an emergency. Laws are different from state to state, but in general, the following conditions must be met: that you are acting with good intentions, that you are providing care without expectation of compensation, that you're acting within the scope of your training, you are not acting in a grossly negligent manner. Negligent actions include giving substandard care, withholding care when you have a legal duty to act, causing injury or harm, exceeding your level of training, Abandoning the person, starting the care, then stopping or leaving without ensuring that a rescuer with the same or higher level of training will continue to care for that person. Consent. It's always important to contain consent before giving first aid. So this graphic here kind of goes through different scenarios and getting consent. So if the person is mentally competent, they are of legal age, and they give you permission either verbally or with a nod of their head, go ahead and give that person first aid. If the person refuses help, but the injury or illness is serious, tell that person of their medical condition, what you propose to do, and why you feel first aid is necessary. If they still refuse treatment, go ahead and call 911. And you can try to have a witness with you to avoid potential legal problems. If any person, adult or child, is unresponsive with a life-threatening condition, we're going to assume that they would accept our help and give first aid. If a child's parent or legal guardian is present or can be quickly contacted, you're going to obtain permission from a parent or legal guardian before giving first aid. If a child's parent or legal guardian is not present or cannot be contacted, you're going to assume that you have permission to help their child. There's no time during an emergency to check your state's consent laws. If professional medical help is needed, call 911. Do not drive the child to the hospital. Driving a child anywhere without the permission of a parent or legal guardian, even with good intentions, can potentially lead to kidnapping allegations. An adult that is mentally incompetent, unable to make rational decisions, you'll want to obtain permission from a parent or legal guardian before giving first aid. In most situations, a law enforcement officer is going to be the only person with the authority to restrain and transport a person against their will. Now, talking about PPE. We want to make sure that we avoid contact with blood and other bodily fluids by putting on personal protective equipment, or PPE, which includes disposable exam gloves. We want to use latex-free if possible. The nitrile gloves are recommended. Eye protection such as goggles or face shields, a mouth-to-mouth barrier device such as a face mask or face shield when giving